It's The Real News. I'm Ben Norton. I'm joined by Ursula Rozum, who is an organizer with the New York Metro chapter of Physicians for a National Health Program. Today we're going to talk about the growing campaign that could potentially soon be successful for single-payer healthcare in the United States. We're going to start talking about the campaign in New York State, and then talk about the national campaign for single-payer healthcare. Thanks for joining us.
It's great to be here.
So can you talk about the work you've been doing here in New York State?
In New York State, I work with Physicians for a National Health Program, and we are one of the founding organizations of the Campaign for New York Health, which is a campaign to pass the New York Health Act, a bill to establish a universal single-payer healthcare system in New York. And it's really a statewide coalition of over 400 organizations that have endorsed this bill, led by PNHP, who I work for, and also the New York State Nurses Association are very involved. And this is a bill that's kind of been under the radar politically, but it's passed our state assembly 4 years in a row, and we're just one state senator short of a majority in the upper house. So we're actually closer than we've ever been to winning universal health care in New York. And the New York Health Act would basically set up a single-payer system, which would eliminate financial barriers to health care, so there'd be no more copays, everything would be covered. And most importantly, everyone would be in one system. So you would have it would be an equal healthcare system. So you wouldn't have different quality of care based on your wealth, which is really key for us.
Have you seen much resistance to this, or do you think a lot of people support it? Because polls show, nationally at least, that a majority of Americans would support a single-payer Medicare for all style system. I don't know about New York State, but what kind of support have you seen?
Support has been steadily growing. The Campaign for New York Health formed in 2014, and we started a round of endorsements from labor unions, then faith groups came on board. Everyone uses healthcare at some point in their lives, and everyone knows someone who has struggled within the current system. So when we tell people that we have a plan to create a universal system in New York for healthcare for all, it's kind of like candy. Like, people really are excited to hear about the plan, about the New York Health Act. And one of the techniques we've been using is we have a testimonials project where we ask people to share their healthcare experiences. And we are hearing so many stories just of people skipping medications, skipping going to the doctor, going into debt because of healthcare costs. So this is an issue that impacts everyone. So I think that's why we've been seeing support steadily growing as people learn about the New York Health Act.
Yeah, I mean, I'll say as a New Yorker myself, I've definitely gone years of my life, different periods between different jobs where I didn't have health insurance, and I certainly have been one of those many people. One of the interesting points about this that I think we hear a lot, especially from conservatives who oppose it, is they say, how can you afford such a single-payer program? But what's interesting is studies show that actually Medicare-style systems, single-payer systems, are in fact much cheaper and have a much lower overhead than private for-profit healthcare. Can you talk about these?
Yeah, we conducted a study in New York State in 2015 that showed by implementing a universal public healthcare system, or what we call single-payer healthcare, New York State could save $45 billion, and also that it would be really working-class people that would see the biggest savings in their healthcare costs. 98% of us would be paying less for healthcare than we do now, but the greatest savings would go to those that are making $75,000, $75,000 annually or less. So this was done by Gerald Friedman of UMass Amherst in 2015. So when conservatives tell us, oh, it's unaffordable to set up universal health care, what we say is that the current system is what's really unaffordable, and most people struggle to afford health care right now.
Yeah, and then let's take a step back and talk about the move nationally to try to create a single-payer style system. The U.S. is totally unique in the world, in the industrialized world, when it comes to this issue. Every other large industrialized nation has a single-payer style system, or at least some kind of universal health care. Of course, many countries in Western Europe, this is totally the norm, and the idea that people wouldn't have health care is actually strange. So can you just talk about the unique situation in the US with private health insurance companies and the move toward a single-payer system?
Well, I think the pharmaceutical and the insurance industries, they're they're universally loathed by people that use healthcare. And I think that's why we're seeing such a growth and support for Medicare for all, because unlike other issues, this is actually an issue that impacts everyone because everyone uses the healthcare system at some point. What's been really inspiring is to see the degree to which healthcare workers have been really driving this fight. Nurses across the country have really been heavily supporting the growth of the Medicare for All movement. We see groups like Democratic Socialists of America making it their main campaign organizing issue nationally. And ultimately, it's universal healthcare would be liberating just for we're all working people, because we would no longer be reliant on the bosses to provide healthcare. But I think here in New York, we have an opportunity to create a model for the nation. And in Canada, universal healthcare passed first in Saskatchewan and spread, to the rest of the country. So we're hoping that New York can be the domino that, sets off a wave across the country of single-payer legislation passing.
Yeah, and then finally, I want to conclude here talking about Senator Bernie Sanders, who, during his presidential campaign in 2016, made this a key point. He tried to push for a universal Medicare for all style system. And since then, we've seen some other, not too many, but we've seen some more progressive figures, including some people in the Democratic Party, who have endorsed a Medicare for all style system. What do you think of this campaign, and do you think that we could potentially see success at the national stage? You said New York could be the first domino, but maybe even a president who would support Medicare for all.
Medicare for all, I think we see it's going to be one of the biggest issues in the 2018 and the 2020 election, because I think it is because of the groundwork laid by the Sanders campaign, and because it's just an issue that caught fire with the American people, because people experience it so viscerally and so personally. And so right now, our strategy needs to be to engage our communities, to speak out about the way that this current system has been hurting people, because it's really those, you said the conservatives will argue that this is too expensive, but it's really our personal stories that are like the evidence, and they're really what can help us put this current system on trial. So I think the prospects are pretty good, but that also the opposition also sees what's coming, because it's so visible that people are clamoring for a different system.
Well, we'll see what happens, and then we'll see what happens specifically here in New York, which, as you mentioned, could be the sign of a potential national movement. I was joined by Ursula Rozum. She's an organizer with Physicians for a National Health Program. Thanks for joining us.
Thanks.
Reporting for The Real News, I'm Ben Norton.